Being diagnosed with breast cancer was terrifying. It feels like the end of the world. I was in the shower and felt a lump and went full panic mode. My main concern was my son. I'm a single mother. He was 2 at the time, and I knew that in my head I was not going to go anywhere. I was going to stick around for him.
When I first met Callee, there were many unique things about her case. One, she was a very young woman when she developed this breast cancer. When we looked at her imaging, she had 2 different spots on her breast away from each other. And when we biopsied those, we actually found 2 different breast cancers in her right at the same time. We initially treated her with chemotherapy. We also added immunotherapy to her treatment, and she went for surgery after that.
Because one of the cancers was hormone driven, the other was triple negative, so it's pretty aggressive. We had a hysterectomy and a double mastectomy.
Fortunately, she was the one who had a complete pathologic response. There was no cancer cell that was found on the specimen from surgery. We are thinking about what can we do to decrease the risk of this cancer coming back. When we think about young patients developing these aggressive tumors, we are thinking if there is any concern for genetic conditions underneath. And she does have a family history of cancers, and with that we performed additional genetic testing, and she was found to have an underlying genetic mutation that put her at an increased risk for breast cancer.
Callee encouraged me to get the genetic testing. I asked my primary doctor here in Holton about it when I was seeing her for something else, and I got them done, and then I had the BRCA2 gene mutation too.
The fact that she carried the gene also made me sad for her, but I was very thankful that we found out hers before it turned to cancer. And I was really glad that she decided to do the testing and do the preventative measures.
I was nervous to do the genetic testing at first, just to know that information and know what to do with it, but it outweighed not knowing and then just having that fear every day of, is today going to be the day I do notice something different and it's going to be too late to be able to do any sort of preventative surgeries or anything, and then I will be going through the total treatment like Callee had to.
We later learned we have a lot of cousins that also carry the BRCA gene. Most of them have done the preventative surgeries. One tested after my journey and her journey and discovered she had it, and she also had the surgeries, so.
Go Atticus, go! Get him!
I'm glad that people can look at my story and decide that they want to push for more knowledge for themselves to be able to prevent anything they can. I think it's a great thing.
I think any patient who have a family history of breast cancer, it's very important that we consider screening for these patients. The sooner we find these breast cancers, again, the outcomes are the best. The current recommendations for breast cancer screening is to start at age 40 and do it yearly. She's been doing very well. It's been close to 4 years since I have known her. And she's a champion all of this over the last few years.
I am cancer-free. I still do labs and follow-ups with Dr. LaCalla and his oncology team every 3 months.
Good job, buddy. Nice.
I'm ready to go to football games and soccer and cheer and be the loud mom at all the games, so. I'm Callee Hainline. I live in Holton, Kansas, and I am a breast cancer survivor.